Welcome to the live webinar today, a CPD session brought to you by iNova Pharmaceuticals and SwipeRx. My name is Gina Gui. I am your moderator and speaker for today's session. Today's session will be shared by two speakers, and the first one will be Dr. Giovanni Hayen, a consultant in ear, neck, throat, and head and neck surgeon from Sunway Medical Center Velocity. Her topic is symptomatic management of painful sore throat and tonsillitis. Her sharing session is 45 minutes, followed by a Q&A session and a poll session. Coming up, the second session, it will be shared by the second speaker, and that will be myself. I'm Gina Gui, community pharmacist, founder, managing director from City Wellness Pharmacy in Penang. And my topic will be AAA expert care of benzydamine against painful sore throat. My sharing session is 45 minutes, followed by a Q&A session and a poll session. If you have any questions, you can start to type it in the chat box. Next, you'll probably be asking on the certificate of attendance. Yes, you will be given a certificate from attending the live webinar session. So please remember to stay on for a minimum of 2 hours in order to get the certificate, as your time of staying in will be recorded by us, and you will be awarded 4 CPD points. After the webinar, SwipeRx will send an email to the address used for logging into the Zoom, containing a link and instructions to download your certificate. So for any questions or concerns, please feel free to reach out at swiperx@gmail.com. So without further ado, let us welcome to share about the first topic for today's live webinar. Before that, let me share on Dr. Giovanni's profile. She is an ear, nose, throat, head and neck surgeon with a demonstrated history of working in the hospital and healthcare industry. Strong healthcare services professional with master's degree. She is currently working at Sunway Medical Velocity Center. She is well versed to treat diseases of ear, nose, throat, and neck areas. So treatment can be given using medication or by doing surgery. So now I pass the session to you, Dr. Giovanni.
Thank you, Gina, for your kind introduction. Good afternoon, everyone. I would like to take this opportunity to thank iNova for the invitation to give the talk for today. As Gina mentioned, so I'll be talking about the management of painful sore throat and tonsillitis. I'll go through the causes of sore throat and the mainly tonsillitis, what's in tonsillitis that we can see clinically, and I'll be sharing some of my patients' profile and how we usually manage the sore throat and tonsillitis. Let me share you my screen. Okay, so the very common symptoms that brought many of us to see the doctors or the pharmacists. 1 in 2 sore throat patients will seek treatment from either the pharmacist or to the physicians. So it's mainly at the throat. What is the throat? The throat is at the upper airway system, where it's digestive and respiratory. It shares these 2 functions, one for breathing and one for swallowing. So pharynx is if you can see this, pharynx is at the back of the nose, at the back of your throat, and at the lower part of the throat. And the other component of this airway is larynx, which is mainly for breathing. And what else in the throat that's mostly important is the lymphatic tissue. Is vast lymphatic tissue is located in our throat. And there's aggregation of this lymphatic tissue, which is, we call it Waldeus ring, where if you can see this in my picture, there are few tonsils located in the throat. We commonly see the one at the tonsils, the big one, the two left and right, but there are a few more tonsils that are located within this area, which is adenoid at the back of the nose. And we have tubal tonsil, which is it's located at the eustachian tube, which is lower down from the adenoid. And we have our palatine tonsil, which is mainly that we see when you open your mouth, and that's the palatine tonsils. And we have lingual tonsil, which is located at the back of our tongue. So this lymphatic tissue aggregation is the main defense system to our body, because we are so exposed to the environment. Like our skin is the first part that we touch anything, bacteria, any dirt to the skin. And through our airway, these are the areas that will usually be exposed first to any irritant. So it takes a very, the function is to initiate any immune body response to any insult. So sore throat, what is it? Sore is pain. So pain at the throat. So you can feel that very pain, heaty and scratchiness at the throat. Mainly, if it's by infection, mainly is by viral, but it can be also bacterial, which is the Streptococcus group A. Streptococcus beta hemolytic group is the mainly bacterial pathogen that cause tonsillitis. But there are a few bacterial infection that also can cause tonsillitis. There's a study done in Malaysia that those who presented with sore throat to the physician, and how many has been diagnosed with pharyngitis. Sore throat can be caused by pharyngitis, or can be caused by other things as well, like allergies, like reflux, you know. So this study has been done in Malaysia. Adult patient, 215 adult patients presented to clinic, and they were examined by the physician. And how many actually has been diagnosed with pharyngitis? How they diagnose pharyngitis is by examining the throat, whether there's any redness, whether there's any swelling, or any exudates in the pharyngitis area. And they found 65% of this patient has pharyngitis, and the rest is just other things. Yeah? And they found 2.8% of this patient, I forgot to tell you, they took a swab. For this patient, they tested for group A Streptococcus. So 2.8% of patient has positive result of Streptococcus. That means the others could be viral, mainly it's viral. So these are the list that we have. What are the causes that can cause infection, viral and bacterial? So viral, there are a few. We have rhinovirus, we have influenza virus, we have parainfluenza virus, adenovirus. And for pathogen, Streptococcus is the main one, but you have to, I'm showing you this as well, because you can see here chlamydia and mycoplasma. These are the atypical bacteria that can also cause infection of the throat. Certain patient has completed antibiotic, the main penicillin group, but then didn't get better, but it think it's mainly bacterial. So it's good to cover for atypical bacteria as well. Other causes of sore throat, anything that can cause irritant to the throat, like allergies, dust, any food allergies, dryness, muscle strain, like if you speak too much, you speak too loud, you're always shouting, they can cause some straining to the throat, can cause also sore throat. Gastroesophageal reflux disease, I will speak to you more about this later. Infection, HIV infection, or tumor, or some other infection of the lower part of the throat, like epiglottitis. So what is actually causing the pain in the throat? Yeah. So mainly when your throat, our throat is lined by epithelium, our respiratory epithelium. So mainly was there's any insult that goes to the throat, when you inhale or when you eat anything that goes into the airway, the main response is actually inflammatory response. So any irritant, any triggers that touch your mucosa, it will cause the inflammatory response. And this inflammation will secrete a lot of inflammatory mediators like cytokines, chemokines, and all these other prostaglandins, right? And after the inflammatory response, it will trigger our immune system response. Then this process will have some changes in the throat. We'll have some swelling, we have some redness and pain in the throat. So mainly all these responses are activated by our tonsils, which is located in this area that I mentioned just now earlier. So what actually happens in the inflammation mainly is inflammation when there's irritants. So these chemokines, cytokines will cause some changes. Mainly first, what happens in the blood vessels is the capillary widening, vasodilatation. So there'll be like more blood flow going through that area that will cause redness and heat at that area. And after sometimes, after the vasodilatation, the increased permeability of the vessels that will cause tissue, that will cause fluids escaping to the surrounding tissue that will cause swelling, edema of that surrounding area, right? And after that, immune system comes in where these leukocytes, our T cells, B cells, cells will come in as an activation of the immune system. And this will cause pain, And then also if you touch, when they swallow, something goes in and touch the area, is odinophagia, which is pain during the swallowing. So this, other than the sore throat for infection, they can have the swelling, the redness at the throat. But other than that, because this is a immune body response, they can also have some pain and swelling at the lymph node in the more of the cervical area. You can see around that neck area, which is lymphadenitis. And other than that, in the tonsil itself, even though it's redness and swollen, it can have some white patches, or we call it exudates. When there's exudates, that means there's already bacterial infection has set into the tonsils. The exudates is formed from the toxin that's been secreted by the bacteria. So the viral infection, mostly you don't see exudate, most of the times. And for bacterial infection, we can see some exudates. I will show you some pictures to you later. Hoarse and muffled voice. This could be because the tonsils are so swollen, it's big and sorry. So this hoarse or muffled hoarse because there's an inflammation that has involved the larynx. The larynx is where our vocal cord stays. If you can see the image here, this is our vocal cord here. So when the inflammation is in the larynx, patient can have hoarse voice. Muffled voice when the huge tonsil is sitting at the throat there is very big, that cause them to have this muffled voice. So this is why they're having these symptoms. So tonsillitis is the inflammation of the tonsils. And like I said, viral and bacterial can be one of it. So this is the picture to show you how you want to differentiate for the viral or bacterial, because mainly is viral. Our URTI is mainly viral, but for certain patient and certain group like immunocompromised, certain pediatric patient, they can have bacterial tonsillitis as well. So how to differentiate that? For a very healthy young patient, we suspect it to be viral first. So for the first 1 to 3 days, we expect if there is a 3 days sore throat, it could be just viral. You can have just redness, sore throat, adrenophagia, and they can still have fever. And if the symptoms prolong to 5 days or 6 days, and then the pain is getting worse, it could be because of some bacterial infection has set in. When you examine that tonsil, for inflammation in viral is just redness, swollen tonsil, And you can see some swollen redness at the anterior pillars here. Okay. And if you can see at the back of the throat here, this is the posterior pharyngeal wall. That's the posterior wall of the pharynx that you can look at it as well, and it looks red. So this is just red and mainly is virus. There's no exudates. Whereas for bacterial, you can see this whitish or this exudates, and it can be little, it can be a lot. But when this, you can see some spots of white here, mainly is bacteria that you need to start antibiotic for the patient. So this is the patient clinically. This is a tonsil. See, this is the white spots that we see. You can see a lot, you can see little, but you try to pay attention to it. You can have exudates on the tonsil. And at the back of the throat here, you can see some lobulated. This is because of this posterior wall of the tonsil, of the pharynx as well. It has some tonsil tissues, small ones, which is swollen because of the infection, that it appears to be like this on examination. And this small here, this is your uvula. So this is scope that we scope the patient if we are looking from top down. This is anterior and this is posterior. So on the left is the normal looking pharynx and larynx. You can see the vocal cord, the mucosa is pink. There's no inflammation. This is good. And on the right side, you can see this. If you look at the back of the pharynx wall, this exudates. They're full of white patches. And you can see some spots at the near the larynx at the epiglottis here. All these spots are the exudates because of the infection, bacterial infection. So this, I share you with the image video. This is how usually we examine. You go through the nose to the back of the nasopharynx and are looking down. We at the oropharynx level. Now we can see there's two tonsils here. And you can see the tonsils are full of exudates, and you can see a lot of laryngeal mucus, the phlegm mucus has been produced by the mucosa in the pharynx because of the infection. And that one is moving, that's your vocal cord, that's the larynx. So examine larynx doesn't seem to be much involved in this patient, but you can see the tonsils is enlarged, inflamed, and it has a lot of exudates. This is another one. You can see here, okay, this is at the back of the nose. That's the adenoid. This is adenoid. You can see the adenoid have minimal exudate with some thick mucus discharge. And the adenoid is swollen, edematous. And now we're going down from the nasopharynx, we're going down to the throat there. And you can observe here as well, the lobulated behind the posterior pharyngeal wall. These are the other lymphatic tissue that has been inflamed, but the larynx look pretty clear for this patient. This is a 9-year-old girl that presented after 1 week of antibiotic is not getting better. So it's because the adenoid is still inflamed. So I continue another week of antibiotic. And not just bacterial. I've come across patients with fungal tonsillitis. They don't respond to antibiotics, full courses antibiotics, and the swab reveal candidiasis. So this patient is actually fungal tonsillitis. A young patient, not immunocompromised, but he has fungal. After we started the voriconazole, he got better. So you can see all the exudates that's all around the tonsil. This is the lingual tonsil. It's a lot of exudates on top of it as well. And a lot of laryngeal mucus here, and the posterior pharyngeal wall is also, we can see a lot of exudates. So in clinic, what can we do? for those, we try to reduce the exudates, especially the one in the adenoid, because there's no way you want to clean it. So we can perform suctioning and removing the exudates so that the antibiotic can work better and faster. Gently suck out all the exudates. You can see the adenoid is very inflamed and very thick exudate on the surface of the adenoid. This can be done mostly in adults. And then after this suctioning, usually we'll do some nasal douching to make sure the remnant of the exudates and all the mucus will be cleansed. So that's the tonsillitis. It can be adenoid and other tonsil and another part of the pharynx. The other condition that patient can come in complaining of sore throat is the abscess, peritonsillar abscess. What's the difference between tonsillitis and peritonsillar abscess? Abscess is collection of pus. Where is it collected? It's collected in between the tonsil and the pharyngeal wall, which is more laterally located than the tonsil. And we can see this picture. The tonsil is not really enlarged, but there's a bulging at the superior lateral part from the tonsil. So this is where the collection of the pus is. For this one, definitely is bacterial. It has to be treated by antibiotic, but before that, we do incision and drainage to drain the tonsil, to drain the pus. How you do? We just do per oral. We make a nit somewhere here and drain the pus, and then we maintain with a gargle and then antibiotic. The other part is laryngitis. Larynx is just located anterior to the pharynx. So it can have infection that patient can present with sore throat as well. It has acute and it has chronic. So acute is less than 3 weeks. What can cause it? Any irritants, also some infection, any straining, like you shout, like for those who use their voice a lot, like for example, teachers and singers, they do come in with very frequent laryngitis. Other than sore throat, the other symptoms that patient can present with is hoarseness, because the vocal cord where the right and left just now was moving, it can get inflamed and swollen. That's when the voice is hoarse. And they can have dysphagia if it's a very bad swelling around that area, because they share, I mentioned to you, pharynx, hypopharynx is the sharing of the swallowing and breathing. So they can have problem with swallowing, and also if it's very bad swelling in the larynx, because that's where the opening to our airway, to the lungs, patient can have difficulty in breathing. For rhinorrhea, if it's coincides with rhinitis or any nasal symptoms. And symptoms for acute viral, usually within 1 week, 5 days, it will go off by itself. A normal infection within 1 week, it will go off by itself. For chronic laryngitis, it can happen in certain situations, most commonly in those who smoke, the smokers, because the irritation from the cigarette smoke cause chronic inflammation of the larynx. And also some irritant from asthma inhalers, the budesonide inhalers can cause some irritation and swelling in the larynx as well. The voice misuse, and the other one is laryngopharyngeal reflux, which is very common. I've seen in my clinic that patients with laryngopharyngeal reflux come in with sore throat and throat discomfort. Other than sore throat, they can come in with frequent throat clearing, like they have to, they keep doing that because they feel that something is there. They always phlegm in the throat. Cough, persistent cough is not a chesty or productive cough. It's more of irritative cough. Why? Because it's when the acid comes to your throat, is a reflex to the throat as a protective mechanism, because the reflux is actually acid content, and the stomach content is very low in pH, is mostly acidic. When it touches the throat mucosa, it will irritate the throat, and that it will trigger the cough reflux. And patient will always have global sensation. Global sensation means they feel there's always a lump in the throat. They feel there's something there, but they don't know how to explain to you. Why is this? Because the reflux, the acid in the throat has caused chronic inflammation, which means that it has caused the surrounding mucosa in that larynx to be edematous, is like a bit swollen. That's why they do feel this global sensation at the throat. And also hoarseness is it has involved the vocal cords. As you can see, if you can appreciate this picture, this is the part of the throat this is the larynx, the posterior part of the throat, where behind this is where the esophagus is, where is the opening of our food passage. So any reflux will come from the posterior part of the larynx and will come and irritate the mucosa of the larynx. So you can see mainly the changes of the larynx at the posterior part, which is this one. You can see redness and swelling of this. This is a part called arytenoid of the larynx, arytenoid cartilage of the larynx. And it can also cause further anterior to it. We can see the vocal cord is edematous. It should not look like this. It should be more thin and white. In this picture, it's all swollen. So what can cause reflux? So mainly if lifestyle activity, how they eat, how they take their meals, what do they eat mostly. So those who have these factors will have higher risk to develop laryngopharyngeal reflux, or we call it LPR, laryngopharyngeal reflux. Those who have heavy diet in acidic, those who likes to take lemon, oranges, all this are very high. It's good with high vitamin C, but it causes irritation to the throat because it's high in acid. Fatty foods, why? Because fatty foods and oily food will cause the stomach to secrete more acid, more secretion for them to be able to digest the fatty foods. So it'll be more acid secretion, more stomach secretion that can actually overflow and go have a reflux to the throat. Caffeine mainly is because of it cause the weakening of your sphincters, of your esophageal sphincter, upper and lower esophageal sphincter. Alcohol also, because it can cause, you irritate the throat and cause more acid and stomach content to be produced. Eating large meals before going to sleep. The larger meals you eat, the more acid and also stomach content need to be produced to digest. And you need at least 3 to 4 hours for it to be completely digested. If not, you will continue to be digesting, and you lie down when you go to bed. So when you lie down, because of the gravity, and the acid will flow up to the throat. Obesity is because of the pressure. When your body, the abdominal pressure is higher, you press on your stomach and cause all this reflux to go up. And smoking, okay? So these are some of the pictures that show these changes in the larynx. It's all looking edematous, all is so swollen, and that's why they feel uneasy, sore throat, discomfort, and global sensation in the throat. Aphthous ulcer is another thing that is in the oral cavity. It's just aphthous ulcer is the in the oral mucosa, and that be many causes that can cause of aphthous ulcer. It can be local cause or systemic cause, and these symptoms is painful, and it needs some treatment to ease the pain in the mouth area. And what about oral mucositis? This is more generalized condition in the oral cavity, mainly for those who are immunocompromised, for those who are undergoing chemotherapy, because the mucosa in the mouth is like our skin, it has a barrier. It has its own barrier, it has its own flora that is supposed to be balanced to keep the hygiene and the health of our oral cavity. For those patients who are immunocompromised, those patients undergoing chemotherapy, their body is immune system is low, and they will cause some barrier in the mouth to be disturbed and can cause some infection and inflammation in the throat. So it's very painful. They sometimes cannot drink and eat at all, so it needs some treatment to ease the oral cavity pain, so at least they can take something orally. So we go to the management of sore throat. Mainly it's symptomatic, and for those who has bacterial infection, we start antibiotic, and so those who doesn't respond or those selected patient, we go for surgical treatment. I go roughly to go through this treatment for these patients. So mainly, as it's mainly viral infection with no infection, we go for symptomatic management. How is that? For patient come to you, or patient you have like this 1, 2, 3 sore throat, it's not that bad. So it's mainly viral, where your body usually will eradicate the viral infection on its own by your own body immune system. But it's painful, so you need to treat the pain. So for treating the pain is topical. By topical is gargle or spray, or you can take some tablet as painkiller. And for those who has more symptoms, like the fever is more than 38 or 39 for more than 3 to 5 days, and those who has chesty productive cough, and those that clinically we can see exudates on the tonsil, that this patient, and we need to start antibiotic. Some patient we take swab, and depending on the center, if you don't have the facility, you can start antibiotic for the patient. So for symptomatic, what do you do? So mainly, I mentioned just now, the oral hygiene is very important. So our mouth is our skin, like our skin, we have to take care of it for it to be at a very optimal level of the barrier. So what is the main thing? Is hydration. You need to keep your mouth hydrated by taking at least 2 to 3 liters of water. Hydration will make the barrier stronger, and at the same time will increase your body immune system to fight any viral infection in the throat or in the mouth. And if you're having pain is quite significant, that you need some painkiller, pain reliever, you can start with paracetamol, or for a stronger one, we can start NSAID. And topically, to reduce the inflammation and the pain at the throat, you can take throat lozenges and gargles. And for DEXA, steroid is only for selected patients, mainly for those who are involving airway, like laryngitis, with very bad edema of the area. We need steroid to reduce the edema and will provide airway for the patient, so that patient will not have shortness of breath. This is by the guideline in Malaysia, how to treat our sore throat. And for antibiotic therapy, as Streptococcus group A is the mainly majority is involved is pharynx and larynx area. So we always mainly target to this group. Why you start antibiotic for this group? Because for immunocompromised patient or for high-risk patient with heart problem, they can have acute rheumatic fever, which can cause the valve of the heart to get infected as well. And to prevent of getting any complication, like abscess formation, and also starting antibiotic for clearly proven bacterial infection make the disease shorter, they will recover faster. Penicillin group is always the first line to treat tonsillitis and also pharyngitis, usually 7 to 10 days. for mostly 7 to 10 days. If it's a very mild infection, you can go for 7 days. It's very quite more severe infection, you go to 10 days. Certain, we can go to 14 days, depending on the severity of the patient. Penicillin group or penicillin with clavulanic acid, erythromycin or the same group azithromycin for those patients who we suspect having atypical infection or who are also allergic to penicillin. And clindamycin is another group of antibiotic for those who cannot tolerate these other two groups. And cephalosporin also will be another group of choice for tonsillitis. For surgical treatment, who are the candidates for surgical treatment? For those having recurrent tonsillitis, and for those who had history of peritonsillar abscess, the collection of the pus. So recurrent tonsillitis, nowadays we always see how frequent is the infection. 5 times a year, or they can have it like every year for 3 years, for 3 times. So it depends on the physician, on the doctor, the surgeon, when you want to do it. And some patients that have very severe 3 times a year, but it's a very acute and severe that need admission in the hospital, they can undergo tonsillectomy as well. For those who had history of abscess, we recommend, because we know that there's a space, potential space in between the tonsil and the muscle that can have recollection of pus the next time they have infection. Because what is dangerous about this is actually the space of that tonsil, if it's not treated, it will trickle down and can go down all the way to the airway and to the mediastinum. If it's not treated and it has extended low down, okay? So tonsillectomy, we do it per oral. This is the intraoperative picture of how we open the mouth and have to visualize the area of the tonsil. This patient has very huge tonsil. This is 9-year-old girl, recurrent tonsillitis since like three years ago, and then the tonsil is this huge. So we remove the tonsils. About the same. So this is a tonsil, grade 3, and this is immediately after the operation. You can see the airway is already big now, and patient is felt a lot better after the surgery. This is adenoid, where also we have to address this condition if they have adenoid hypertrophy, especially in children, because this adenoid hypertrophy will obstruct and narrow the airway at the back of the nose. And this is mostly the cause of snoring in children. So you can see the nasopharynx, which is the nose at the back of the nose here. There's adenoid hypertrophy that is actually blocking the airway like up to 90%. So, and we ablate the adenoid. So after that, patient will have a lot more airway and the snoring is gone. So we're back to inflammation, okay? We're back to inflammation. What are the inflammation signs? So heat, because of the vessels that's running through is dilated. So when the blood flows to the area, it brings heat. So it becomes heaty, redness because of the vasodilatation as well. Swelling because of the increased permeability of the vessel, causing the fluid from the blood vessels going through to the tissue, escaping to the tissue that's causing edema and swelling. And the pain because of the cytokines, all these inflammatory mediators that's been secreted during the process. And loss of function, for example, for the throat, is painful and patients are unable to swallow, and this is causing the loss of function of the throat. So we're back to the symptomatic treatment, okay? Mainly is pain. We want to alleviate the pain in the throat, okay? So we have this benzydamine, our Deflam. It has 3 actions, which is anti-inflammatory, analgesic, and anesthetic. I will go through just a bit because later our second speaker, Gina will speak more of the mechanism of action of benzydamine. So it is a type of NSAID. It has anti-inflammatory effect. So how it does is it will inhibit the production of pro-inflammatory cytokines, mainly tumor necrosis factor alpha, interleukin I beta, which is the major driver of the inflammation. And it has also activity as cell membrane stabilization, okay, reducing both capillary vasodilatation and release of pro-inflammatory substance. So this benzydamine diflum, it can penetrate through the skin, through the membrane, and it causes anti-inflammatory effect. Benzydamine is NSAID, but it's a different type of NSAID, which has superior function, where it's mainly not acidic. You know, our NSAIDs have a lot of GI symptoms that can cause a lot of peptic ulcer disease, can cause bleeding because of the cyclooxygenase inhibitor. But benzydamine doesn't have that effect, and it has more membrane stabilizing effect, and it has local anesthetic effect, which other NSAID doesn't have. But benzydamine has this local anesthetic effect, and it has poor protein binding, high free drug, and as compared to other NSAID, high protein binding with low free drug. Okay, so there's a study done to see effectiveness of benzydamine with chlorhexidine, diflum C, in treating sore throat, adrenophagia and dysphagia in patients with suspected or confirmed with COVID-19 infection. So they've done this study. Patients were instructed to gargle 15 ml of this solution containing benzydamine and chlorhexidine for 30 seconds to 1 minute at 1.5 to 3 hours interval based on the prescription. And then for the duration not exceeded for 7 days. And patient is asked to at least take the solution once a day for the subsequent 7 days. They have collected 290 patients, which are mostly females. So, and then they use VAS score, which is the pain score of the throat, at baseline, after 30 minutes, after 60 minutes, after 6 hours, after 12 hours, and bedtime. And they take the median of the VS score. We can see from the baseline, the median score is 5, and at bedtime, the median score is 3, within the same day after they use the gargle. There is a reduction of pain score of the sore throat. And this is from on the same day, and this is on subsequent days, where day 1, day 2, and day 3. We can see from day 0, the median score is 5, and from day 5, there's already 0 pain score. When they take it every day, there's already 0 pain score of the sore throat. And majority did not experience any adverse effects from this treatment. They have a bit of mild mucosal numbness or also taste disturbance. So you can see the data show resolution of the throat irritation by day 5 using diflum C gargle compared to 7-10 days. So chlorhexidine is a cationic biguanide used in general medical practitioner as antibacterial or antiseptic, mostly for the oral cavity, for the gargle. So this is good for those as well for mild infection of the throat and also the tonsil. Another study has been done. This is a new study. They compare using diflum gargle and also diflum lozenges and evaluate the sore throat in patient. We go at this, the blue one, okay? So they've collected about 300 something patients, which half of it use spray and half of it use lozenges. And they use sore throat relief rating scale, where after they take the lozenges and the spray, they are asked to rate the sore throat score at 5 minutes, 10 minutes, 15 minutes, 30 minutes, 60 minutes, and 120 minutes after they use the medication. So you can see improvement of the score, of the pain score for until 120 minutes. So as a conclusion, both spray and lozenges are effective. Either one you can use to treat the sore throat as a pain relief from this study. So you can either use a spray or you can either use lozenges for this patient. So the sensation of swollen throat were reduced by treatment with benzydamine within 120 minutes. Anesthetic and analgesic properties of benzydamine spray and lozenges effectively address the patient prior to relief of the symptoms of UTI. Okay, so this one for the mechanism of action, I'll leave it to Gina to explain more regarding the DFLM. Okay, thank you. This is the end of my talk.
Thank you, Dr. Joanie. We have one question from the floor.
Okay.
Yeah, it says here, hi there, just wondering if there's a new CPG in progress. I think he meant the management of sore throat ones.
Oh, you were still using the old CPG, actually.
Yeah. So I think maybe not now, not now in progress, not now yet, Okay. I think we have one question that's from the floor. Okay. Any more questions from the floor? Oh, okay. I'm just gonna share my slide deck. Yeah. So there's one more question from the chat box. Can pregnant and breastfeeding take DFLM?
Maybe I'll leave it to this one. What do you think?
I think there's not enough data to show the safety and effectiveness. So generally I'll say no for this stage. Yeah, then refer to the doctor. Yeah. What do you think, Dr. Joanie? How would you?
Usually I don't give for pregnant and breastfeeding patients. It's more of I give them the other type of the hyaluronic acid spray that we have, which is like we use for babies and for pregnant patients as well. Yeah.
Okay. We have one question from the Q&A part. Is it necessary to use DFLM and NSAIDs or only advised to use either one?
NSAID as in oral, I think this is why.
Yeah, DFLM and NSAIDs together.
But usually we go for topical. If it's under control with topical, regular spray or regular gargle will ease a lot of pain at the throat. Only when necessary, we use a systemic painkiller like for paracetamol or for.
Okay, sure. So another one. May I know what types of antibiotic cover lymphadenitis?
If you're talking for cervical lymphadenitis that's caused by our upper airway, we use the same antibiotic as well because we know the same pathogen that has caused the upper airway pharyngitis, tonsillitis is the one that's causing the cervical lymphadenitis. So it's always penicillin group is the first
group. All right.
Sign of treatment.
So one more question. Can Serrata or Papace to be used to treat sore throat?
What is that again?
Xarelto or Papain is a type of anti-swelling medication, but it's not under
Antihistamine, I think. That's antihistamine, right?
Xarelto and Papain is like a papaya
Yeah,
extract and all that, huh?
for sore throat. If
Yeah.
this one is more relatable to allergies, like certain patient, I didn't mention much about that. Certain patient with coexisting rhinitis allergies, that they have a lot of inflammation because of allergy. So that one we use antihistamine. We will combine with antihistamine to reduce the swelling, edema, and also to reduce the mucus in the nose and the nasopharynx area.
Okay. I think we have many more questions, but I think we'll select final three. Okay, one is from can 6 years old and below 6 years old use deflam throat spray?
Sorry, again?
Below 6 years old, do you prescribe deflam throat spray?
Throat spray.
Below 6.
Usually I prescribe for more than 6. We have another option for younger patient, which is a hyaluronic spray.
Hyaluronic spray, yeah. Okay, sure. What antibiotic can be given to treat tonsillitis for patient post-splenectomy on lifelong penicillin V? It's a bit more.
Okay. This one, I think, is more of that patient with a bit more immunocompromised. I will go for a combination a combination of a treatment. I can go for cephalosporin if we try the first generation. If not, we can go for second and third generation, depending on how severe the infection is. We try oral first and mix with azithromycin. If it doesn't help, then you need to go for IV.
All right. So one more. Can G6PD deficient patient suitable to take benzydamine?
To take what again?
Benzydamine. G6PD patients.
I don't think there's any contradiction, right? Can you confirm?
I don't think so. Yeah. No.
Yeah, I don't think there's any contradiction for that.
So can be taken then.
Yeah.
When would you prescribe deflam raspberry honey lemon over deflam mint? You know, there are two versions of deflam.
Okay.
One is with the combination antibacterial and anti-inflammatory, and the other one is only anti-inflammatory. When would you give the one with antibacterial? Okay,
then it goes back to the previous one. If it's just viral, anti-inflammatory one is adequate. Yeah, and if there's any bacterial, you suspect any bacterial, you can use with the antibacterial.
Okay, sure. All right, I think we get the last one. For immunocompromised patient, can we prescribe deflam throat spray for long-term management or oral thrush? Immunocompromised patient, can we use deflam throat spray to treat oral thrush?
Oral thrush. I don't think deflam is okay to use for long-term, I think, right? It's more for a short-term treatment because it's an NC anyway. It's an NC. It's not always good for a long-term treatment for oral thrush. Oral thrush is mostly you have to go for hygiene. You have to make sure the mouth oral hygiene is stable. Which is that we have a few of more natural kind of gargle that will stabilize the enzymes, stabilize the flora of the mouth. We do more of that, so that the oral thrush will be, will be lesser once the enzyme in the mouth is lesser. Yeah. Okay. There's an option for that as well. There's an option of gargle that we have that is more natural and is more of stabilizing the enzyme and flora of the oral cavity. Okay, we'll use the other types of oral thrush, then not this for long term. All right, I think that's all the questions been answered live webinar. Okay, I think there's no more. All right, thank you very much, Dr. Joanie. We'll go. Thank you for the attention. Yeah, thank you, Dr. Joanie. We'll go on the poll session now. Okay, ladies and gentlemen, now is the end of the session 1. We will go on the poll. So I was going to start the poll. Okay, there are 3 questions. Okay, for poll for Dr. Joanie. Okay, I'm just gonna launch the first one. All right.
it says here, how would you rate the content of the session? So you can just press, yeah, it's starting to roll now. I'm gonna leave it for like 2 minutes. And then I'm gonna end the poll. Oh, it's all, you have more than half of the people answering the poll. Okay. About 200 people answering the poll. So just click if you are satisfied, very satisfied, satisfied, neutral, dissatisfied, or very dissatisfied. I think most people will select more than satisfied, yeah, version. So 1 more minute to go. We have about 227 people hit the poll.
Okay.
100 plus to go. So we have around 100 plus people not yet do the poll. Can you please click on your answer for this question? We have about 30 seconds left for this question. Once the time is up, I'm going to end the poll and show you the results. Okay, we have about 252 now, then 10 seconds to go. 5 seconds. Okay, gonna end poll now. So I'm gonna share the results. I think okay. Did you see the results?
Yeah.
Okay, I see like yeah, more than half I've say unsatisfied and very satisfied. All right, so let's go to the second one. All right, launch the second poll. How would you rate the speaker for the first session, Dr. Joanne Hand? So let's 2 minutes for this poll. So you can rate very satisfied, satisfied, neutral, dissatisfied, or very dissatisfied. You have about 2 minutes to answer the poll. So we have now about 200 packs answering the poll. So we're gonna 219. It's very fast.
Yeah.
Yeah. Please answer the poll. So 1 minute passed, so we have another minute for you to answer the poll. 238 going to 240 now. Many answered satisfied and above. So we have about 45 seconds. Then we're gonna go to the last one on poll number 3, and that's all for Dr. Joanne's session. We have 30 more seconds to go. 246 people answered the poll. We're gonna have about 30 seconds. Yeah, 30 seconds to go. All right, we have 20 more seconds to go. Any more? All right, 10 more seconds. So now with 2 minutes is up, I'm gonna end the poll. So I would say that 95% of people have voted satisfied and above. All right, so let's go to number 3. Okay, after this session, I have a better understanding about the symptomatic management of painful sore throat and tonsillitis. Oh, very fast. We have 2 minutes again for this poll. And now we have near 190 people voted, answered the poll. So most agree, some strongly agree. We have about 232 people voted. We have about 50 seconds passed, so we have about 1 minute left. Please answer the poll if you haven't. This is the last question. Then we're going to proceed to our section 2. So now we have about 250 packs answered agrees to strongly agree. You have probably around 40 seconds left, okay, for the poll. And after that, we're going to on the poll and show you the results. And we're going to move on to the section 2. Okay, 20 seconds left. So we have 10 seconds left. 263 people voted, and 99% has voted agree and strongly agree. So we have 10 seconds left. Sorry, that's all. So that's the end of the poll. Thank you, Dr. Jenny.
Okay.
The poll ends well. Thank you so much. So I'm gonna continue on the second session of the webinar. Okay, thank you for staying on the webinar. And thank you, Dr. Joanny, for sharing the topic on symptomatic management of painful sore throat and tonsillitis. It was indeed very insightful. I've learned a lot from you, especially looking at all the visuals, okay, that we don't usually see. And I would like to thank iNova Pharmaceuticals and SwipeRx for the invitation, okay, to moderate and also to share on my experience, okay, on this subject. So today is my topic on AAA expert care of benzydamine against painful sore throat. So, hello again, I'm Gina Gui, a practicing community pharmacist for the past 22 years, also the founder and managing director of City Wellness Pharmacy in Penang. So my passion is to help people to improve their health outcomes in minor illness management and also chronic disease management such as diabetes. So currently, I'm also serving in the Malaysian Pharmacy Society as a council member and also the Pharmacy Board of Malaysia as the advisory board member. So let me now start the sharing session on this topic. So this is just a little bit of disclaimer on the information or other material contained in this slide presentation is being provided as an information service and as a professional courtesy. So it is not intended to be a substitute for professional medical advice, diagnosis or treatment, and it's only for educational purposes. So the views and opinions expressed here are those of the speaker and do not necessarily reflect of the official policy and position of iNova Pharmaceuticals. So again, we're going to touch on the management of sore throat, but today I'm actually sharing from the perspective as a pharmacist. Okay, as you can see, as Dr. Johnny has shared, there are 3 areas, okay, symptomatic treatment, antibiotic therapy, and also surgical treatment, which have already seen some photos of it. So, so as you can see from the guideline, right, it is actually been shared earlier. So, as a community pharmacist myself, we have all walks of life, okay? People from all walks of life actually walk into the community pharmacy at any time, all right? I do notice that a very common problem, okay, that people face, okay, is actually sore throat also, okay? And different people will tell you different stories about their throat, okay? But one thing they actually want is a fast cure so that they can function like normal again. Just how Dr. Joanny said that, people like a singer, teachers, frequently have this problem and they actually wanted it fast because they may have competition or they may have to speak again very soon. So they are looking for a fast cure. So as you can see on this slide, okay, quite a busy slide just now, as you have seen, okay, it's actually extracted from the clinical practice guideline of Malaysia, okay, on the management of sore throat. So after you have assessed the clinical feature of the people having sore throat, that those walk-in or any patients that you know, they will probably tell you that they have rhinitis, hoarseness of the voice, cough, or even conjunctivitis, diarrhea, or even the oropharyngeal ulcers that you can see. Okay, of course, because it's a primary care setting, so we can only do yes or no, or we need to refer to a doctor when needed, right? So if it's the clinical features as presented just now, as I mentioned, it's normally most likely is a virus type of sore throat, okay, and not a bacterial type. So for this symptomatic treatment becomes a very essential part in managing sore throat in adult and children, so which I will share on in the next slide. So, but on the other hand, so we have also people or patients, okay, have a fever, or maybe they have swollen lymph nodes, okay, they try to tell you that it's swollen on my throat, or maybe I can see that white patch inside my throat, okay, or any pus, okay. But maybe you can also see tiny red spots, they try to open up the mouth and show you. Okay, after collecting, the information, the patient may be suffering, okay, from the bacterial infection or strep throat, okay, we talked about this. And these are actually a very, red flag symptoms identified. So when this case happens, a red flag happens, so it is actually normally best to, okay, refer to a doctor for further diagnosis tests. Okay, maybe they need a swab test, or they need antibiotic to get a cure, right? So as mentioned, okay, these are the common symptomatic treatment, all right? You can see in the clinical practice guidelines of Malaysia in management of sore throat. So what are the symptomatic treatment? Okay, so as you can see here, there are 5 areas or 5 classification. So as a general measure, you have to inform your patient to make sure they drink a lot of water, okay, because you need to get them hydrated. All right. So normally I say, do you drink enough water? The first thing they'll say, oh, I rarely drink water. That's it. You have to encourage them to drink more water, at least 8 glasses or even more, right? Normally I'll define 8 glasses so that they can also understand, oh, 8 glasses is that much, okay? So secondly, simple analgesics or antipyretics. We call it, the common one is paracetamol being given, okay? Normally, paracetamol is quite safe to be given, but not aspirin, because let's say for little children, you just have to be careful on the risk of the Ray's syndrome, right? Can see. Then thirdly, as you know, the NSAIDs, okay, the very popular one is ibuprofen, okay, but of course there are many downsides of this. GI bleeding, okay, unintentionally, and they can so the regular use is not recommended. So fourthly, throat lozenges or gargles are commonly seen, all right. You can use suggest, they will probably say that anything that's common, so that they can start to make sure that the throat is not scratchy or itchy and all the time. Or simply they will just say, oh, you suggest any gargles. Sometimes I'll just say, oh, I started with the salt gargle and so on. Okay, so it is actually very useful, okay, as an adjunctive therapy with those having throat issues, okay. And finally, okay, you probably have seen medications such as dexamethasone has been used as an adjuvant therapy for severe acute exudative pharyngitis. So it is also very useful, and it is also a very rapid onset and bring down the pain very fast. In fact, further studies are needed to make sure that the effectiveness and safety, those with positive culture. And finally, vaccination against influenza and pneumococcus has been shown to result in further reduction in the episode of acute sore throat. And again, more evaluation is needed. So bear in mind that anything that's need the doctor's prescription as a pharmacist, we still have to inform the doctor for it. Okay, these are all we call it red flags. Okay. So as mentioned, many types of sore throats are in fact viral. Okay. But how about those that needing antibiotic. So if viral antibiotic, actually we don't need antibiotic, because it's more than 85% of it, all right? So because very common, some they come in and say, I have a sore throat, I need antibiotic. But you have to at first assess that if you're virus or a bacterial type of pharyngitis first before you even conclude that, antibiotic is being given. But in such a case where antibiotic is needed, all right, it is only effective, all right, for group A, streptococci causing acute pharyngitis. And ideally, a throat swab, okay, is needed before starting taking antibiotic, as mentioned earlier. And in fact, why we need to use antibiotic? Because some people may have even more serious symptoms, and maybe they have hidden rheumatic fever. Okay, you want to prevent it, or there are pus coming out already. Okay, prevent the suppurative complication. Or finally, you want to improve the condition because you want to decrease the infectivity and shorten the clinical course of the disease. So after all, we don't want to be sick and always lie on the bed, right? So we want it a relief fast. Okay, so the next question is, I think it's being mentioned already, which type of antibiotic, right? So penicillin is really the common one in the market, okay? Still remain the choice for the group A streptococcal pharyngitis because it's narrow spectrum, proven to be efficacious, safe, and also low cost. So in case that the oral therapy is chosen, normally, as mentioned, 7 to 10 days is recommended. So to make sure that the eradication is at the maximum rate, okay, to make sure that the infection gets cured fast. Because imagine if it's if it's a teacher or singer coming in, they need it fast, okay? So if penicillin is not recommended in case that they say, oh, I'm penicillin allergy, what should you do? So we have, of course, other options as like, for example, erythromycin and to be the second option. So what if people who are allergic to both, okay, penicillin allergic and also erythromycin intolerant, what should they do? So in fact, for this case, can still offer like maybe clindamycin on this category of patient. So, but bear in mind, sometimes the recurrence of acute strep throat infection may happen due to inadequate dose or duration of previous therapy or non-compliant by the patient. For example, they probably be taking antibiotic just for short term. Okay, they probably taken 2 capsules and they say, oh, I'm well now, I don't have to take more. Okay, I'm sure you've seen this kind of patient. Okay. All right. Just now we have seen a lot of photos shared by Dr. Joanne on the tonsillitis tonsillectomy. So there are people who actually opt for surgery, okay, in case that all other treatment doesn't be happy. I mean that they can't actually get cured. Okay, some may have multiple episodes of tonsillitis over the 12-month period, and definitely it will interfere with the patient's normal daily function. So in that case, of course, surgical treatment after being in a consult, you can refer to your doctor to that and all that, because definitely this is a red flag identified. Okay. So as a community pharmacist, I'm sure that I've been mentioning about red flag and what is a red flag for sore throat cases. Okay. If you have patient coming in and tell you I have sore throat, and then you start to ask, how long was it already? And they say, oh, it's already been more than 1 week. I tried all sorts of lozenges, gargle, whatsoever, it doesn't help. And even I go to Chinese herbal medicine shop and all that, it doesn't help. Okay, is actually a red flag for you. And maybe some of them will find out, oh, I'm very hard in breathing and I cannot swallow well and all that. So in fact, it's actually, they have to be careful, okay? Another red flag for you. And upon asking, they say that I have fever, okay? And it's more than 38 Celsius. And that's another red flag. And some people may have recurring sore throat. Just now I mentioned, they may be warrant a tonsillectomy or so on, okay? That actually need a further assessment by the doctor. And some people loss of voice, okay, but they thought that the loss of voice is normal to them, or maybe their voice is like that, and then they feel that, oh, it's so-called sexy, sexy voice, but actually that's a hoarseness. And if it's more than 3 weeks, that's actually another red flag. And some may have some skin rashes, okay, on their body, and they'll think, oh, what's that? If you have identified such symptoms in your patient, okay, it's actually another area of concern, and you have to continue monitor, or straight away you refer to a doctor. Okay. So remember, you are there as a community pharmacist to improve the quality of life of the patients. So any red flags identified need to be rectified as soon as possible. Just don't leave it there and thought that it will just disappear. Because a lot of time when they come into the community pharmacy to seek for help, some of them already been sick for a while and they cannot, wait anymore, and they want a quick fix straight away. So they expect this to happen also in the community pharmacy setting. So we have been discussing about treatment options. Again, this is a bit of recap. As you know, there are preparation for our ulcer and inflammation. We talk about NSAIDs and all that. And analgesics, antipyretics, okay, NSAIDs drugs, antibiotics, anti-infectives. How about supplements and adjuvant therapy? I'm sure that some will say that I want it recover faster other than taking medication, or what should I do? Okay, so adjuvant therapy and supplements, we will not talk too much of it, but things like garlic oil, vitamin C, zinc, echinacea, and so on actually will improve, okay, the duration of sickness. Okay, some will actually boost up the immune system so that they can get well faster. But if they have symptoms of the sore throat already, you still go back to the symptomatic treatment of it, okay? So moving on to the patient advice. So some sore throat will actually clear up within a week. So if you have a patient asking you about how long would I recover because I have a competition to sing, but I have a sore throat now, okay? They'll say, oh, 1 week is fair enough, all right? But throughout that 1 week, you advise them to get more rest, okay? Probably don't talk so much because the more you talk, you'll probably be hurting your voice box, right? And use a humidifier to eliminate dry air that can worsen the sore throat, because sometimes they may thought that, oh, we need more air conditioner, and in fact you actually need a humidifier. Okay, it's quite common, especially for little children. Okay, the parents will actually on the humidifier and put certain essential oil and all that, right? Another tip is actually gargle with warm salt water. Okay, sometimes they may not find any other gargles. Okay, the simplest one, you can say, oh, just at least, okay, a warm salt water, and for temporary relief. Okay, and drink plenty of water. In fact, we talk about getting the throat hydrated. This is very important. All right. Suck antiseptic or anti-inflammatory lozenges to soothe the throat. Okay, this is very common because sometimes you may not have water all the time with you, so you want something just to soothe the throat so that you keep hydration, and you can improve the duration of it. Okay, avoid alcohol and caffeine, which can cause dehydration. Some people they will actually ask, okay, if I'm on certain medication, can I still drink alcohol? Okay, so in fact, or even coffee. So if you can, okay, try to advise them that no alcohol when you're sick, at least 1 week, okay, no coffee and tea for at least 1 week, because the more coffee, anything that contains caffeine, and the more alcohol that you drink, it may cause even your throat become even more dehydrated. Okay, and finally, this one is I think very common when you're sick. You have to eat foods that are easy to swallow. For example, broth, soup, yogurt, or even cold treats. Okay, especially for little children who have big sore throat, I'm sure they don't want to swallow anything. So I would say that slight changes in the daily lifestyle is very important, so that the sore throat can be cured faster, and after seeking the advice from the pharmacist, the community pharmacist, right? So moving on to the next slide, it's actually, again, we go on to the solution. Okay, what is the solution? So the topic today is actually on AAA expert care of benzydamine. As you know, okay, benzydamine is a very unique drug because one drug has 3 functions, right? So recap: anti-inflammatory, anesthetic with a local effect, and analgesic. So as you know, benzydamine actually comes available as a hydrochloride salt. So it's a locally acting and non-steroidal anti-inflammatory drug with local anesthetic and analgesic property for pain relief and anti-inflammatory treatment of the inflammatory conditions of the throat and the mouth, right? So that's how one drug can have 3 actions, and it's definitely very unique and says for a topical application, and it is established a very safe, and very good safety profile, gastro-friendly, and so far no known drug interaction. So again, we go back, okay, to the action of it. Actually, previous sharing by Dr. Joanny has already talked about anti-inflammatory. Just a little bit of recap. So there are 3 actions, all right? I think as a pharmacist, you just have to be reminded, okay, on the function of it. So the first one is actually inhibition of the production of pro and inflammatory cytokines, okay? Mainly they call it the tumor necrosis factor alpha and interleukin-1 beta. So these are actually major drivers of inflammation and having little effect on anti-inflammatory cytokines. So the second one is actually elicit supportive anti-inflammatory activity through cell membrane stabilization and reduces the capillary vasodilation and the release of pro-inflammatory substances. So basically, it's a very powerful drug. So once it's being applied topically, it strongly reduces the swelling or inhibits the pro-inflammatory cytokines, and immediately you can, quite instant, okay, you can see the pain and swelling being reduced. All right. So this is the photo of you can look at the photo of the spread and swollen tissue that you can see. Some patient will tell you that I have a sore throat, but it's not swelling. Some will tell you that, but sometimes they may not understand. Okay, at tissue level, it's actually a swollen condition, as you can see from this photo here. So if you wanted to explain a bit further, for your patient, you probably can show them this little photo. Look quite red and angry here. Basically, it's once you apply benzydamine on the area, you will actually reduce the inflammation. So there are 5 areas of anti-inflammatory action of benzydamine, okay, because it's quite specific and focused. Can see the item 1 there, okay, specific concentration and focus analgesic in activity in inflamed tissue, okay. It can provide this focused analgesic activity. So once you spray on, you can see it reduce very fast. Okay. Second one is actually reduce the neutrophil aggregation. So neutrophil is actually one of our white blood cell. Okay. Once you spray on it, all the white blood cell will actually start to be reduced. Thirdly, inhibits the production of pain and inflammation mediators. Okay, just now we mentioned about the TNF alpha, okay, the pneumocnecrosis factor alpha. So in fact, talking about this, it's good, right? I mean, if a patient has got the pain, and once you spray, okay, it can instantly reduce the pain already. Okay, you can see that. Item 4 inhibits the vascular permeability and reduce the edema and erythema. Okay, this is about the redness, the swelling, and all that. So I would say that it's good. Okay, quite instant. Okay, so that's why benzydamine is ideal for topical application and the management of acute pharyngitis and tonsillitis for this case. So moving on, we're going to this. All right, it's like going back to study your chemistry, but basically it's telling you this is a structure pattern of local anesthetic drug. You don't have to remember it. It's going to tell you that there are rings, okay, the hydrophobic rings, aromatic ring, and the hydrophilic quaternary amine. And in between, there are chains, okay, the ester, ether, or amide linkage to actually chain that out. So when you look at the actual benzydamine structure, okay, this is how benzydamine hydrochloride look like. So you can see there are aromatic rings, and then you can see the hydrophilic quaternary amine, and you have things all linked up. So when you identify this, that means that it provides the anesthetic, okay, effect locally. So benzydamine, similar to other local anesthetics, reversible block nerve conduction occurs when topically applied to appropriate concentration. Okay. So moving on. So this one, as mentioned, benzydamine is actually non-acidic and gastro-friendly, where you compare to others. okay, it may be acidic, and it can cause ulcer on the stomach, right? You wouldn't want this for long term, so it'd be good to have a topical one, okay? So it's membrane stabilizing, and also lack of membrane stabilizing effect if compared to others, local anesthetic properties, and poor protein binding, high free drug. So basically, these are the good part of the benzydamine hydrochloride when you compare to others, right? So I think I'm going to share about some clinical studies, all right, of benzydamine itself, because there are some, going to share about 4 studies today, all right. This is the first one. It's a double-blind study of benzydamine hydrochloride, a new treatment for sore throat, okay. This is done by Washington JF, okay. It's a double-blind study, means that, the patients don't even know what they are taking. It was published in Clinical Therapeutics, but it was in 1985. Since then, it's already been popular, right? So in this double-blind study of benzydamine hydrochloride, in fact, it was a new treatment then. So there are 44 patients with sore throat, okay? And you see there are 21 of them, okay? 44 patients with sore throat participated in a placebo-controlled double-blind clinical trial, okay, of benzydamine hydrochloride and administered as a gargle. Okay, this is a gargle one. So after medical evaluation and short culture, so 21 patients were treated with a solution containing benzydamine, and 23 patients with placebo. So 21 know what they're taking, and 23 of them don't know. Okay, so after the analysis, all right, they actually showed that benzydamine solution significantly relieve, okay, the pain and dysphagia upon 24 hours, and then the placebo solution. So the physician evaluation at 24 hours showed that benzydamine solution had significantly greater effect than the placebo on hyperemia and edema. So it means that anything that's swelling, causing redness and all that is significantly reduced. So side effects were minimal and there's no clinical significance. The findings indicate that the benzydamine hydrochloride is safe and effective therapy, okay, for the signs and symptoms of the sore throat. So this one is telling you about the score line. You can see the left and the right. So they in fact they compare it using the improvement scale, okay, comparing the benzydamine and placebo. So the light blue, okay, ones the bar, okay, are using the benzydamine, and the placebo is on the blue one. So you can see, it's quite a significant difference, okay. After they will say that the pain is less, the dysphagia is less, hyperemia is less, and edema is less. So so you can see it's quite a good comparison for this purpose. So this is moving on, okay, it's the second one, all right, a comparative study of benzydamine hydrochloride, okay. They use the pump then. This is a spray. Just now was a gargle. This is a spray as analgesic following tonsillectomy. So this is for people who have done a tonsil operation, okay, and this is done by this researcher called J. Riddington Young. Okay, is from UK. So this double-blind study conducted is a bigger one in 56 children and 4 to 11 years old. Okay, to assess the usefulness of benzydamine hydrochloride, 0.15% in prophylactic reduction of post-operative pain following tonsillectomy. So you can see that the study has successfully showed that benzydamine was more effective than the placebo in the control of post-operative pain, and there were no side effects and no unwanted side effects. Okay, in the medications were well tolerated. Okay. So this is the even more, okay, more objective in the background. Just now, as I mentioned, this is on the spray, and these are the children being assessed. Okay, so and this is the outcome. All right, the spray actually reduced the post-operative pain in children post tonsillectomy. Right, so in fact, you can see that after 2 days, the condition of the soreness of the throat, otalgia, or dysphagia, and the appearance, okay, of the tonsillar bed has been improved okay, by using the spray, because the spray pump is actually quite direct and you can just spray directly to the tonsillar bed of the patient. Okay. Now I'm going on, okay, to the third study. Okay, this study actually evaluate the benzydamine hydrochloride and versus the placebo, all right, in the abscess ulcer. And this was written by S.L. Yankel, C.A. Welsh, and E.H. Cohens. All right, these are the professor, I would say in Pennsylvania. All right. So in this study, the recurrent abscess ulcer or Cragger sores are characterized by painful lesions of the oral mucosa. Okay, the treatment of this ulcer, which has varied according to the number of and severity of the lesions, has been topical or systemic or even a combination. So the purpose of this study is actually evaluate the subjects. Okay, this time they're using the solution. Okay, I would say the gargle again. Okay, I would say that using the 0.15% solution of a benzydamine hydrochloride by comparing it with the identical appearing placebo solution. So the study was conducted in the double-blind manner again, and the patients were instructed to rinse the area of the mouth with the ulcer with 15 ml of the solution for 20 to 30 seconds. All right, and then this is how it's being scored, right? And the subjects recorded both their estimate of pain, okay, the pain score prior to each dose, and the pain relief at specific times after dosing. So in addition, patients rated their pain relief as more of less 50%, less than 50%, or more 50% improvement, right? So you can see that this is the gargle that can see, and this is the result, okay? The pain relief score of 3.07 with benzydamine hydrochloride was significantly superior to the 2.776 score with the placebo, right? You can see that again, it's quite effective in reducing the pain, okay, comparing with the placebo in the double-blind study. All right, so 61 of the subjects reported at least 50% improvement in their pain relief after using the benzydamine mouth rinse, and compared to the 22% after using the placebo. So now we have benzydamine mouth rinse also successfully improved pain, right? So this is the fourth study that we're going to share today. It's actually a bit on COVID, okay? A throat lozenge with fixed combination of cetirizine, all right, chloride and benzydamine hydrochloride has direct virucidal effect on the COVID-19 virus, right? So this is the study published in 2021, okay, to examine the virucidal activity, right, of this lozenges. Now using a lozenge, right? So the aim of the study is actually to examine the virucidal activity, right, of CBC and a combination of benzydamine hydrochloride, and also the CBC as a free active substance or as a lozenge, okay, on the COVID-19 virus. All right, moving on. This is a very busy slide, but again, the result showed that under in laboratory stimulated conditions of lozenge, okay, after they administer, so the virus was incubated in 3 different concentrations of each substance. The first one is the CBC itself. The second one is actually the benzydamine hydrochloride and CBC, or the BH as and CBC combination. So this was is as a lozenge for 1 minute, 5 minutes, and 50 minutes of the contact time. So you can see that the infected viral particles were detected in cell cultures, and the viral titer was calculated accordingly. So the results has actually showed that all active substances in high concentration suspensions as well as medium concentration, okay, of the BH-CBC combination exhibited a 4-log reduction in the viral titer. So the highest concentration of the BH CBC as a lozenge has a faster virucidal effect, okay, compared to CBC as a free active substance alone. So a contact time as short as 1 minute, okay, you can already see the result. So in fact, the lozenge again proven to reduce the viral load, okay. So in the conclusion, this study actually demonstrates, okay, the effective, strong virucidal effect of the lozenge with the possibility of viral load reduction in the oral cavity, and consequently, already reduce the risk of the viral transmission. Okay, so it's actually reducing risk. So it's good that it's quite effective in reducing the viral load itself. Okay. So I'm just going to share on the types of Deflam, okay, available in the market, as some of you will already be quite familiar, but just going to share, there are lozenges, there are throat sprays, all right, there are gargles, and also the mouth gel, okay, in case some of you may not aware. So these are the types of products available in the community pharmacy setting. So in the Deflam formula, all right, the key ingredient, namely the benzydamine hydrochloride, provides a AAA expert care, okay, with over 50 years of clinical experience. As just now, as already mentioned, the clinical studies can be as early as 1980s already. So the formula is very stable, okay, and it's definitely a unique and safe, okay, for topical application, with a very safe profile and gastro-friendly with no known drug interaction and targeted pain relief, okay, for people who wanted the instant cure, all right. Definitely it has 3 action as mentioned, all right, as anti-inflammatory, and anesthetic, okay, local anesthetic, and also the analgesic effect. So I would say that I think with throughout the years, okay, Deflam has been a very stable product, and I myself actually recommended quite a lot of it, because some people will prefer, okay, using the spray. Some people using the lozenges. Some will say that I will prefer gargle. It's actually each will use a different type of formulation, but many of them will actually coming back for repeats whenever they have the problem in sore throat. In fact, I myself have used it before, and definitely quite targeted. Okay, so as mentioned, this is the sore throat spray, the Deflam spray. So you know that you have to actually tilt out, the nozzle, okay, and target or hard to reach inflamed and painful areas. So you just have to ask them to open the mouth, open the nozzle, and just spray 2 squirts, just, and you can feel the instant pain and swelling activity very, very much, very fast. I myself used it before. It's quite palatable, okay. Rapid action, very easy to use, especially hard to use area, and very accurate dosing, because once you squirt is 1 spray, 1 spray, 2 spray, and very convenient. You can bring along. Okay, you can in fact put it in your handbag, or in your backpack, or whatever, right? So this one is the lozenges. As you know, in fact, there are 3 types now. Okay, target to diffuse inflammation and redness around the throat and mouth, okay, in patients presenting with burning pain, swollen and irritated throat. So it's quite palatable. Okay, there are 3 types of flavors. You can see the green one is the mint, the yellow one is the honey lemon, and the red one is actually the raspberry. So I think if you remember clearly, the yellow and the red ones contains benzydamine, and also the citalpyridine, I would say that the CPC, citalpyridinium, all right, and the green one is actually benzydamine itself. So it's actually quite fast and very convenient. It come in the strips. You can put to bring it together with you, and just pop it in your throat, whenever you feel uncomfortable. So very fast in reducing the pain and irritation too. Okay, and this one is the gargle. So this is formulated to target painful inflammation involving the whole mouth and oral cavity. So for people who more at home type, okay, because you need to gargle and you need to spit it out, right? And it's a local delivery to a larger pain and inflamed areas in the oral cavity, but don't swallow it, okay? Just gargle and then spit it out. Okay, local relief of oral lesions. I would say that, just I mentioned about different type of oral cavity problems, and definitely is soothing and refreshing sensation. Okay, So that's about it. Thank you. That's my sharing. So I would like to go to the Q&A. All right. So may I know, there's one question here. May I know when to start antibiotic, any criteria or any center score? In fact, if the patient, just now we mentioned about the CPG guideline, and we have the, if you differentiate between the virus and the bacteria, and you definitely know it's a bacterial infection. So with this, normally, if it's confirmed it's a virus, a bacterial type of meningitis, okay, strep throat, for example, normally I will refer to a doctor already, okay? Because we cannot just initiate, as a pharmacist, we cannot initiate antibiotic then. So for me, I'll just refer maybe to my doctor next door, or you have to ask the patient to go. Normally, they will need antibiotics so that they can improve, okay? Yeah, they reduce, okay, the infectivity quick, okay, right? So I would say that as soon as possible. Second one is actually different gargle can be used below 4 or not. Oh, I won't advise to use below 4. They will worry that they will actually swallow it. In fact, normally I suggest above 6 years old only can use. So anyone below 4, if it's a virus, normally there has hoarseness of the voice. They can't talk well. They won't eat well. Normally you have to immediately, you have to refer to a pediatrician, right? So the one coming up is is there a maximum doses for Deflam spray or lozenges? Yes, there is a maximum dose. In fact, I mean, if not mistaken, there's a maximum of I think you can do every 4 hours, maximum of 12, not mistaken. Yeah, maximum of 12 lozenges in a day. So for the spray, also I would say that every 4 hours is good. All right. Some they will do it every 1.5 to 3 hours, every 1.5 to do it. All right, then you can use it. Do not exceed 7 days. So if you do it like every 3 hours, I think there's a lot of sprays used. Okay. All right. May I know why Defend Purple one is recalled from the market? The Defend Purple, the lozenges contains codeine, and recently is being recalled because of the global recall due to the effect on people who are having the anaphylactic shock. Okay, I think after during the surgery and so on. So I think because of the codeine content that's being recalled, the others do not contain codeine. That's why it's not being recalled. Okay, what is the period after opening of the different spray? I would say as long as you look at the expiry date, there's no you can use it as long as you can, as long as you keep it in a closed dark area, or in the bag or inside your closed cupboard. There's no expiry date like eye drops and so on. You can use it as soon as at the end of the expiry date. So this one. May I know benzydamine spray and gargle help with mouth ulcer? If the mouth ulcer you have pain, okay, if you have pain straight away, yes, why not? You can use the spray and the gargle to relieve the spray, to relieve the pain. Some will actually use the Deflam mouth gel. You can apply on it. Okay, this is topical because when the mouth ulcer, you can see a whitish spots. You can on the mouth itself. So you can just dip on it using the gel. Definitely spray and gargle can relieve. Okay, as you know, benzydamine can have reduce inflammation, anesthetic effect, and also pain effect. Okay, you can use it. Can I take Deflam and NSAIDs and PEPAs together? Any polypharmacy issue? Yeah, I'll say I've seen this being dispensed before, but unless the patient is very, very painful, okay, normally you can do it either one. And of course, PEPAs is something quite mild. It may not have much indication in reducing the swelling so fast, okay, unless some people will say, I don't want any medication at all, they want something natural, then you have to go with something natural. But of course, you have to see how's the case is like. definitely you say Deflam is topical, NSAIDs, okay, some will actually be oral, okay, tablet form. Papace is also in tablet form, okay, unless necessary, otherwise I won't give 3 at once. I'll in fact based on the symptoms that's needed, okay, I won't use 3 at the same time. So what should we do if accidentally swallow the Deflam gargle? Good question. If you intentionally swallow the whole bottle, I think you need to be admitted to the hospital for emergency, like intoxication. But if you accidentally really, swallow like maybe 1 ml, 2 ml, or even a little bit, I think it's still okay when causing toxicity. I'll say that you probably have to drink a lot of water. If you're really concerned, okay, then you have to monitor yourself and admit yourself to the hospital. But if it's just a little bit, it's fine. If it's unintentional, it's fine with me. If it's intentionally, you swallow a whole bottle, I think this is already a suicidal case. Can pregnant and breastfeeding mothers take Benzydamine? This one just now we mentioned no. Okay, just now there's one question during Dr. Johnny's session. Okay, what is the dose of the oral erythromycin if the patient is allergic to penicillin? I think the usual one is like 200 to 400 milligrams 4 times a day. I think this one can be referred to a doctor too, but I think this is a usual dose. And is it safe to use Deflam in pregnant? I think this is being answered. I would say no. Can Deflam lozenge taken together with a spray? Well, I would say that don't take them together because it's a duplication already, unless you say that you forgot to bring it out in a lozenge. You can take either one, but I would say that don't double up the thing, because it's already the benzydamine inside, each of the formulation. May I know what is how long is the storage of the benzydamine spray and gargle upon opening? I think it's the same thing. You can use it until expiry date if you store it, in a proper storage condition. Okay, like you close it up, you put a box, and put it inside your cupboard. Don't just expose to sunlight and all. Okay, what is the maximum duration of Deflam lozenge and throat spray can be used? Maximum duration, I think I would say up to 1 week, not more than 1 week. Don't use it continuously like for nothing. Okay. Is it true Deflam is sugar-free because it tastes nice, something to use for diabetic patients? Well, it's sugar-free. I think they use a sugar substitute, so it's low in calorie. So I think they use sorbitol, if I'm not mistaken. Yeah. So definitely make you feel taste a bit nicer so that you want to take it, right? If it's something very not palatable to your taste bud, I don't think anyone would want to take it. So it's safe for diabetic patients. Yeah. So any advice if patient accidentally swallow Deflam solution? Yeah, this one I already answered. You have to be sent to a emergency department if swallow intentionally. So are all variables of Deflam suitable for certain population of Asian patients? Yeah, just now mentioned if you worry about the content of the lozenges and too much sugar, you can always use a spray. I think spray is good enough. Yeah. So hi there, can Deflam cross spray be taken? No, I won't say you can do it together, but I think alternate lah. Don't do it together because it is already there. Why you want to double up, right? What is the maximum of a dose of benzydamine in mg? Oh, let's say patient use at the same day, or is the same maximum dose for each product? Yeah, I would say because each of the formulation contains benzydamine, so you have to calculate the total amount of benzydamine used for a patient in 1 day. Okay, just now I mentioned maximum of 12 lozenges of benzydamine, 12 lozenges in a day. So you see, one benzydamine lozenge contains benzydamine hydrochloride 3 milligram. So you take 12 of them is already 36. So you just have to identify each of the formulation how much mg it contains in benzydamine, then you total up. But you don't just take them at the same time, right? Benzydamine is necessary use until diluted. I think if it's for serious cases, you can use undiluted. If it's normal, not so serious, you can use it. I think it really depends on cases. Okay, why benzydamine cannot be given to pregnant? Well, I'll say that there's not enough safety profile, okay, being demonstrated, so that it's not safe for pregnant women. All right, I think any more? Let me see. Any more on the chat area? Okay. Some patients say that the phlegm lozenges are too numbing and make their sore throat worse. Any answers? Yeah, because it has local anesthetic effect, it will actually numb the throat. So it's actually numb the throat so that you don't feel the pain. I would suggest the patient need to also keep the throat hydrated, right? And make sure they drink enough water because it's symptomatic treatment anyway. So I won't say that the phlegm make the throat worse. It's actually the effect of the numbing that people cannot tolerate. Okay, if that's the case, you probably don't use the throat lozenges. Then you can probably use other method like throat spray or gargle. Okay, can dialysis patient take the phlegm lozenge or spray? I would say, because it's a local one, so I would say use according to dose is fine, right? Unless doctor banned from using it, unless it's very critical. I wouldn't say you would just have to omit them if it's very, very critical and you're not allowed to use any other medication. So in case that happens, you have to refer to the doctor who is attending them. Yeah, not even gargle for pregnant women, or it's just local acting. So I would say that because we wanted to be safe, if for me, for pregnant women, I will go for natural therapy, okay, first, unless it's very serious, or in cases like tonsillitis and so on, best to be referred to a doctor for the checkup, because you will want to take a risk for the baby. Yeah. Do patient need to withhold certain types of nasal spray or inhaler during acute tonsillitis or pharyngitis? I would say not necessary to withhold it, because nasal, I would say that it won't be a straight issue unless you want to space it out, okay? Unless it's very acute and you warrant a surgery, and then that will be a separate matter then. Yeah, I think I've answered all the live questions. Yeah, okay, I think we will move on to the poll session, okay? Because time is limited. All right. Okay. Can't really move the slides in. Okay. All right, I'll move on to the poll session first. Wait. Okay, now I'm gonna move to poll sessions. There are five poll questions. Kindly please answer it, because each will take about 2 minutes. Okay, first one, how would you rate the content of this session? Very satisfied, satisfied, neutral, dissatisfied, or dissatisfied? Okay, we have 2 minutes. Please answer them. Okay, we have 30 seconds past. We have 2 minutes for this poll. Can you please answer it? We have about 240 participants answered the poll. We have about going to be 1 minute left. So we can answer very satisfied, satisfied, neutral, dissatisfied, very dissatisfied. All right, there are 2 minutes, near 2 minutes. Now we have about 45 seconds. We have about 264 people answered the poll. About 30 seconds left. You have about 20 seconds left. Going to end the poll very soon. We're going to proceed to the second question. We have 5 poll questions today for this session. Okay, time is up. Gonna share the results. So I would say that many voted very satisfied, and some neutral. Okay. So it's going to proceed on the second question. So how would you rate the speaker for the second session today, Gina Kui? There are very satisfied, neutral, so dissatisfied, very dissatisfied again. So please answer it. Thank you very much. You have about 2 minutes to answer the poll. Can you please rate the poll so that we can see what are areas of improvement? So we have about 1 minute, 30 seconds to fill out this poll. We have 3 more questions to go. So it's gonna be very quick. We have 1 more minute left. We have 1 more minute left. Please rate the poll. Very satisfied, dissatisfied, neutral, dissatisfied, or very dissatisfied. We have about 1 minute left for the poll. Forty-five seconds. I'm gonna share the results shortly. I have about 30 seconds left. Okay, we have about 15 seconds left. All right, we have about 10 seconds left. We have around 284 participants answer the poll. Thank you very much. So I'll share the result now. So the result showed that many voted satisfied and above. Okay, thank you very much. So I will stop sharing, go to question 3. Question 3. So this question, after this session, I have a better understanding about the action benzydamine against a painful sore throat. Can you please rate this? Agree, strongly agree, and you have 2 minutes to answer the poll. Yeah, kindly answer the poll. We have about 21 people answer the poll. We have about 2 minutes. Okay, now it's going to be near to 1 minute. After this session, I have a better understanding about the action of benzydamine against the painful sore throat. So we have 1 minute left. About 45 seconds left. We need more answers. Yeah, all right. That's good. We have about 30 seconds left. Can you vote this? After this session, I have a better understanding about the action of benzydamine against painful sore throat. So you have about 20 seconds left. Okay. End of the poll. Okay, I'd like to share the result now for question 3. So more than, I would say that 293 people participated, so mostly agree and strongly agreed. Okay, I will stop sharing the result now. I'm going to question 4. Okay, how would you rate the content of this webinar in relation to your daily pharmacy practice? Extremely helpful, very helpful, neutral, slightly helpful, and not helpful at all. So can you please rate the poll? You have about 1 minute, near 1 minute left, okay, to rate the poll. Can you please rate the content of this webinar in relation to your daily pharmacy practice? So was it extremely helpful, very helpful, neutral, or slightly helpful? Okay, you have 1 minute left. You have about 30 seconds left. You have one more question, okay? Stay with me for one more question, and that's it. And then I have 2 more announcements, and that will be the wrap up. There are 20 seconds left. Kindly rate question number 4. So about 10 seconds left. All right, thank you very much. I will share the result of the poll. So 282 participated, and they are rated very helpful and extremely helpful. Okay, thank you very much. Okay, final question. How likely are you to recommend SwipeRx CBD webinars to other pharmacy professionals? Extremely likely, lightly, neutral, unlikely, and extremely unlikely. Can you please rate the poll? So we have about 1 minute, 30 seconds for this poll. Please bear with me. I'm going to share the result for this soon. So how likely are you to recommend SwipeRx CBD webinars to other pharmacy professionals? First one is extremely likely, lightly, neutral, unlikely, or extremely unlikely. So highly rate. You have about 1 minute left for this session, for this poll. About 1 minute. So how likely are you to recommend SwipeRx CBD seminars to other pharmacy professionals? Extremely likely, lightly, neutral, unlikely, or extremely unlikely? Have about 30 seconds left. To date, about 277 people voted. So can you please rate it? Okay, you have about 10 seconds left. That's the end of the poll. We have 5 questions answered. I'm going to end the poll now and share the results. Thank you for voting. So this one, we have 280 people participated, more than 53%, I would say 53% voted lightly and 42% voted extremely lightly. Thank you very much for your voting. All right, so I'm just gonna share 2 more slides. All right, bear with me. This one is how do I get my certificate? So I'm sure that you have stayed on for at least 2 hours because your time will be recorded. It's already past 2 hours now. After the webinar, SwipeRx will send an email to the address used for logging into the Zoom, so containing a link and instruction to download the certificate. In case you have problems doing that, please reach us at swiperxmy@gmail.com. Okay. And finally, we're gonna have our second event, all right, by iNova Pharmaceuticals and SwipeRx. Okay, the next topic is the role of muscle relaxants for low back pain management by Dr. Sanjeev Rampal, an orthopedic surgeon and senior lecturer from Faculty of Medicine and Health Sciences, University Putra, Malaysia. And the second speaker and also the moderator will be Mr. Bosco Mu, the community pharmacist from Alpro Pharmacy, Bukit Sedang, Selangor, and he will share the advantages of fixed dose combination therapies. So again, it is a live webinar. 4 CBD points will be given. The date will be on 5th of August, Saturday, 2023, from 2 to 4 p.m. So kindly register now. If you're interested, you can go to the SwipeRx app to register. Sign up there, you can see on the right, or you can scan the QR code now, okay, to register for this webinar, the next coming up webinars, all right? So I would say that's the end of this session. This is the final slide. Thank you very much for your participation. I hope to see you on the next session. Thank you.
SwipeRx.